While assisting a resident to the bathroom, you notice smoke coming from the ceiling vent. What is your first action? A. Evacuate the resident immediately through the nearest exit. B. Investigate the source of smoke before moving the resident. C. Close the bathroom door, evacuate all residents from adjacent rooms, and call for help. D. Ignore it if the resident is calm. Answer: C. Immediate containment is key. Closing doors slows smoke spread. Safety for all nearby residents takes priority while alerting staff to the hazard. A resident on high-flow oxygen begins coughing violently and sparks appear near the oxygen tubing. What is the safest response? A. Spray water to put out the sparks. B. Turn off the oxygen immediately and evacuate the area. C. Cover the tubing with a blanket to smother sparks. D. Ignore it until the nurse arrives. Answer: B. Oxygen supports combustion. Turning it off and removing residents prevents fire or explosion. Using water or fabrics can worsen the situation. During a tornado warning, a CNA finds a resident refusing to leave their windowside room. How should you proceed? A. Physically move the resident to the shelter. B. Explain the risk, guide them to the designated safe area, and stay with them. C. Close blinds and leave them in place. D. Wait until the tornado arrives. Answer: B. Residents retain autonomy. CNAs must combine safety guidance with patient-centered support to ensure compliance. You notice a resident's pump is alarming, but the resident insists they feel fine. What is the correct procedure? A. Silence the alarm and continue care. B. Check the site, pump, and fluids, and report to the nurse immediately. C. Remove the line yourself. D. Ask the resident to ignore it. Answer: B. Alarms may indicate infiltration, blockage, or dosage issues. CNAs must investigate safely and report to licensed staff. A resident's wheelchair brakes fail while transferring them to the bed. What should you do? A. Hold the resident with one hand and push with the other. B. Call for help and stabilize the resident using safe techniques. C. Attempt to repair the brake immediately. D. Let the resident sit on the moving wheelchair. Answer: B. Preventing injury during equipment failure requires immediate stabilization and requesting assistance, not solo intervention. You notice water pooling under a resident's bed after a leak in the ceiling. What is the safest immediate action? A. Push the bed aside and mop later. B. Move the resident safely, prevent slipping hazards, and report maintenance. C. Ignore it if the resident is asleep. D. Cover the water with a towel. Answer: B. Wet floors create slip hazards. Residents must be moved safely and hazards reported promptly. During a facility lockdown due to a chemical spill, a resident insists on going outside. How should you respond? A. Restrain the resident to prevent exit. B. Calmly explain the danger, stay with them, and follow lockdown protocol. C. Let them leave briefly if they promise to return. D. Ignore their request. Answer: B. Safety protocols during chemical exposure protect all residents. CNAs must enforce rules while maintaining calm and dignity. A resident wearing a personal medical alert device triggers an alarm, but they are confused and wandering. What is the appropriate CNA action? A. Ignore the alarm if the resident appears unharmed. B. Safely redirect the resident to a secure area and notify the nurse. C. Remove the device immediately. D. Ask the resident to fix the device themselves. Answer: B. Confused residents may bypass safety measures. CNAs must prevent injury and report alerts promptly. A resident's call light flashes continuously, but the resident is trying to exit unsafely through a fire exit. What is the correct action? A. Stop them immediately and escort back to room. B. Activate the fire alarm to stop exit attempts. C. Guide them calmly to a safe area and inform the nurse. D. Ignore and document later. Answer: C. Protecting residents from harm requires guidance rather than force. while alerting nursing staff for supervision. You notice a small fire in a trash bin near a resident's oxygen concentrator. What is the safest immediate action? A. Use a water bucket to douse the fire. B. Evacuate the resident, shut off oxygen if possible, and activate the fire alarm. C. Smother the fire with blankets. D. Call maintenance first. Answer: B. Oxygen makes fires extremely dangerous. Evacuation and alerting staff is the safest priority. A resident begins seizing while being transferred in a hallway. The resident's oxygen tubing is nearby. What is the priority action? A. Hold their head and move tubing away to prevent entanglement. B. Stand by and wait for the seizure to end. C. Insert a spoon to protect their mouth. D. Call security to restrain. Answer: A. Safety involves preventing head injury and tangling hazards. CNAs must not insert objects into the mouth. A resident's wheelchair battery dies in the middle of a hallway during emergency evacuation. What is your immediate step? A. Push the wheelchair manually to safety. B. Wait for maintenance to arrive. C. Ask the resident to get out and walk. D. Leave the wheelchair and evacuate alone. Answer: A. Manual mobility ensures resident safety, leaving them or waiting risks injury. A resident using CPAP equipment has tubing disconnected during a power outage. What should you do? A. Leave them until power is restored. B. Provide manual airflow with bag valve mask if trained, or notify nurse immediately. C. Remove the device entirely. D. Let the resident adjust themselves. Answer: B. Residents reliant on respiratory devices require immediate intervention. CNAs must stabilize or report for safety. While checking hallways, you notice a container labeled biohazard leaking. What is the correct action? A. Pick it up with gloves and move it. B. Secure the area, avoid contact, and notify infection control. C. Pour disinfectant on it immediately. D. Leave it for housekeeping at end of shift. Answer: B. Biohazard exposure poses serious risk. CNAs must isolate the area and alert proper staff. During a lockdown drill, a resident becomes panicked and tries to climb out of bed. What is the correct CNA response? A. Restrain the resident physically. B. Remain calm, explain the situation, and provide reassurance while securing the environment. C. Ignore behavior. D. Move the resident forcefully. Answer: B. Maintaining calm, verbal reassurance, and environmental safety protects the resident without using restraints unnecessarily. A resident spills hot coffee on themselves and screams. What is your immediate action? A. Remove clothing covering the burn and apply cold water. B. Cover with a blanket. C. Document and wait for nurse. D. Apply ice directly to burn. Answer: A. Immediate cooling prevents tissue damage, ice can worsen burns. Prompt care and reporting are essential. A resident has an automated external defibrillator, AED, nearby, but the floor is wet. What should the CNA do? A. Use the AED directly on wet floor. B. Move the resident to a dry area first, then follow AED protocol. C. Skip AED and wait for nurse. D. Place a towel under the AED. Answer: B. Safety requires a dry surface to prevent electric shock and ensure AED effectiveness. During a lift, the resident becomes combative and resists movement. What is your priority? A. Continue lifting despite resistance. B. Stop, reposition safely, and call for assistance. C. Leave the resident on the floor. D. Use forceful restraint. Answer: B. Resident safety and CNA safety are priorities. Assistance prevents injury during unpredictable behavior. A resident's room smells of natural gas. What is the correct immediate action? A. Open windows and continue care. B. Evacuate residents and staff, avoid ignition sources, and notify emergency services. C. Ignore unless strong odor persists. D. Attempt to find the leak yourself. Answer, B. Gas leaks are life-threatening. Evacuation and professional intervention is mandatory. A resident trips while using a walker, but you notice their shoes are untied. What is the correct approach? A. Ignore and continue walking. B. Assist residents safely, and ensure shoes are tied or replaced. C. Tell them to be more careful. D. Remove shoes immediately. Answer, B. Prevention of falls includes environmental hazards and footwear safety. CNAs should address root causes proactively. During emergency evacuation, a resident becomes disoriented and wanders away from the group. What should you do? A. Chase them immediately. B. Maintain visibility, guide them calmly back to the group, and notify staff. C. Leave them to find their way. D. Shout for them from a distance. Answer, B. Calm guidance and visibility ensure safety without causing panic. Immediate reporting prevents further risk. A resident complains that the smoke detector beeps continuously but no smoke is visible. What is your responsibility? A. Silence the detector permanently. B. Investigate potential hazards and report maintenance issues. C. Remove the battery. D. Ignore if resident seems calm. Answer, B. Malfunctioning alarms may indicate real risk. CNAs should address or report to prevent danger. A resident's bed rail is loose and may collapse. What should you do? A. Continue care and ignore. B. Notify maintenance and prevent use until fixed. C. Attempt repair yourself. D. Remove resident from the bed temporarily. Answer, B. Unsafe equipment must be reported. Preventing use until repaired maintains resident safety. During a water leak, a resident slips in the bathroom. What is the CNA's immediate responsibility? A. Help the resident stand, assess for injury, and notify nurse. B. Clean the floor first. C. Leave the resident and continue rounds. D. Ignore if they are laughing. Answer, A. Resident safety and injury assessment take priority over routine tasks. A resident's oxygen tubing is accidentally unplugged during a bedside care task. What should you do? A. Reconnect tubing and ensure oxygen flow while monitoring the resident. B. Leave it disconnected until nurse arrives. C. Remove tubing entirely. D. Ask resident to adjust. Answer, A. Oxygen-dependent residents require immediate reconnection and monitoring to prevent hypoxia.